New Hampshire's mental health system continues to struggle to meet the demand for services. What legislation, if any, would you support to increase or expedite the training and hiring of mental health professionals, or is this the state's responsibility, Mr.
Well, again,
Brown?
I think a lot of this stuff is on the state. It's not even just with mental health, but children with disabilities. I went to some forums the other day on that and got to learn a lot. But I think that the state is the best to deal with it and to figure out. But to talk more about mental health, something I was talking about in the primary that we haven't brought up much, you need to be 21 years old to buy a cigarette in this state now. But any 12-year-old can sit for 6, 7, 8 hours a day on TikTok and social media. The constant stream, and quite frankly, even your commercials and the fear-mongering that they're doing, is what's contributing to this mental health issue that we have. It's the constant stream of TikTok. It's the constant stream of body image problems that girls are having, or people and boys, let's face it. In this constant stream of all this money that people think that they have, these kids out there that pretend that they have Ferraris on TikTok, but they don't really. But it's causing a lot of these mental health issues, and we should be regulating how much children are on all of these networks and streams and social media accounts, because this is causing the problems.
Congresswoman, what legislation would you support to increase or expedite the training of mental health professionals in New Hampshire?
Well, I've been a big proponent of funding for our community mental health centers, not just in terms of bricks and mortar, that's critically important, but also, as you say, in training and making sure that we build the workforce. One of the bare silver linings that we've had out of the opioid epidemic is that many people who have gotten the treatment that they need and gotten both the mental health and substance abuse treatment so that they are back in the workforce have chosen to go into this field, and I think that's a really important new development. Another piece of this I want to talk about is immigration, actually, because we just recently successfully encouraged the Northern Borders Regional Commission to process a program for J-1 visas for physicians in the North Country. The North Country hospitals were having a terrible time recruiting physicians, and this will help with recruitment and retention. I want to expand that, and I've already been talking with colleagues about how to expand that next session so that that could include other types of healthcare professionals, including mental health.